Welcome to today's lesson on various renal disorders. In this script, we will delve into the intricate details of different conditions affecting the kidneys. We will cover a wide range of topics, including etiology, risk factors, clinical presentation, diagnosis, treatment options, and potential complications. So, without further ado, let's begin our journey into the fascinating world of renal diseases. In this section on renal cell carcinoma, we will cover its etiology, risk factors, clinical presentation, diagnostic methods, including imaging and histopathology, staging, and treatment options. We will discuss key details in an easily understandable manner. Renal artery thrombosis is a rare yet clinically significant condition that leads to impaired blood flow to the kidney. The pathophysiology of renal artery thrombosis will be carefully explained, highlighting factors like atherosclerosis, thromboembolism, and vasculitis. Clinical features, including sudden onset flank pain, hematuria, and reduced urine output, will be covered. Diagnostic criteria, including imaging techniques like Doppler ultrasound, CT angiography, and MRI, will be thoroughly discussed to accurately identify the presence of renal artery thrombosis. We will also explore complications such as acute kidney injury and the management strategies that involve anticoagulation therapy, thrombolysis, or surgical interventions. Renal osteodystrophy, a bone disorder associated with kidney disease, is caused by abnormalities in vitamin D metabolism and hormone regulation. Clinical signs include bone pain and fractures. Lab tests and imaging help with diagnosis, while treatment involves diet changes and medication. Long-term complications like heart disease and arthritis are possible. Renal tubular disorders encompass various conditions affecting the different segments of the renal tubules. The underlying mechanisms of these disorders, such as defects in ion transport, will be extensively discussed. Clinical features specific to each type of renal tubular disorder, including Fanconi syndrome, renal tubular acidosis, and electrolyte disturbances, will be explored. Diagnostic approaches, including specialized tests like 24-hour urine collection, fractional excretion, and genetic testing, will be detailed to aid in accurate diagnosis. Management strategies involving supportive care, specific therapeutic interventions, and treatment of underlying causes will be covered to ensure optimal patient outcomes. Renal hypertension refers to high blood pressure primarily caused by underlying kidney pathology. We will examine the epidemiology, pathophysiology, and clinical presentation of renal hypertension, including renovascular and non-renovascular causes. Diagnostic criteria for renal hypertension, including blood pressure measurements, laboratory investigations, and imaging studies like renal Doppler ultrasound and renal angiography, will be discussed. Treatment modalities, such as lifestyle modifications, antihypertensive medications, and surgical interventions like renal artery stenting, will be thoroughly explored to achieve blood pressure control and prevent end organ damage. The significance of identifying and treating the underlying cause, such as renal artery stenosis or polycystic kidney disease, will be emphasized. In the video on renal disorders and semiology, we will delve into the complexities of renal amyloidosis. We will discuss the pathogenesis, clinical manifestations, diagnostic methods, and treatment options, while considering the impact on prognosis. Renal vasculitis encompasses various immune-mediated disorders affecting the renal vasculature, including conditions like granulomatosis with polyangiitis, microscopic polyangiitis, and renal-limited vasculitis. We will explore the different types of renal vasculitis, focusing on their clinical features, diagnostic criteria, and treatment options. Diagnostic criteria, including serologic tests like antineutrophil cytoplasmic antibodies, ANCA, renal biopsy findings, and imaging studies, will be meticulously discussed. Treatment modalities, including immunosuppressive agents, glucocorticoids, and plasmapheresis, will be detailed, considering the severity of the disease and potential complications. The long-term consequences, such as renal scarring and chronic kidney disease, will be highlighted. Renal papillary necrosis refers to the ischemic necrosis of the renal papillae, often seen in the context of conditions like sickle cell disease, analgesic abuse, and diabetes mellitus. We will discuss the etiology, clinical presentation, and diagnostic methods of renal papillary necrosis. Diagnostic approaches involving imaging modalities like CT scan, intravenous pyelography, and kidney biopsy will be examined for accurate diagnosis. Management strategies, including pain control, treatment of underlying causes, and preventive measures, will be detailed to minimize long-term consequences like chronic kidney disease and recurrent urinary tract infections. In this video, we will discuss the formation of renal abscess, its clinical features, various diagnostic approaches including imaging and laboratory tests, treatment options, and potential complications. In this section, we will delve into the complex topic of renal infarction, discussing its causes, symptoms, diagnostic techniques, treatment options, and potential long-term consequences. We will use terminology appropriate for medical students and provide sufficient detail to enhance their understanding of this condition. Renal oncocytoma is a benign tumor arising from renal tubules. We will discuss its pathology, clinical features, diagnostic methods, imaging, histopathology, treatment options, and prognosis, emphasizing distinguishing features from other renal tumors. In this section on renal angiomyolipoma, we will cover the clinical features, diagnostic criteria, management approaches, and potential complications associated with this distinct tumor composed of blood vessels, smooth muscle cells, and adipose tissue. We will delve into the details of incidental detection, symptoms, imaging techniques, and various treatment options, considering the tumor size and potential complications such as retroperitoneal hemorrhage and renal function impairment. Our exploration of renal disorders has provided comprehensive insights into kidney conditions, including etiology, risk factors, clinical presentation, diagnosis, staging, treatment, and complications. It is crucial for healthcare professionals to stay updated as nephrology research advances for improved patient care.